Hello, Perry Posse. I have a really special treat for you today. Today, I have Jennifer Adesina with me. She's a psychiatric nurse practitioner, and I'll have you tell us a little bit about you and how what you do relates to perimenopause, and then we can jump in with some chatting.
Absolutely. So yeah, I have a integrative psychiatry practice, and I'm located here in Dallas, Texas. Serve throughout all of Texas, as well as virtually throughout Texas and Colorado. And I do take more of that holistic approach to psychiatry. So, what I deem is holistic is looking at the full picture. I'll have clients who'll tell me that, hey, I've been dealing with brain fog, constant, chronic fatigue, irritability, unable to get out of bed, just different, sorts of symptoms, I would say. And then after, thorough conversation, I'm thinking, is there something else going on? Can we look under the hood and see is there any underlining possibly medical conditions that could be contributing? So what I like to say is I do more of some of that functional medicine with psychiatry. So not fully functional medicine, but not fully conventional. So it's a good mix. So that's why, it's Nuvo Integrative. So I really want to be able to see what best service the client. So I'll do some lab testing, optimize any deficiencies, look at the hormones, optimize dose if it's necessary, and then medication. So I'm more conservative with meds, so I don't like polypharmacy and starting all these meds all at once. It's really just educating and see what's the purpose of the med, how is it benefiting you,
Mm.
and hopefully you get optimal wellness and relief, and not just the symptoms but your overall well-being. I do work primarily with, some women for reproductive concerns. So it could be PCOS. Perimenopause is becoming more, the hot topic these days. So I love my peri women and helping them with the endless symptoms that they've been,
Yes.
encountering, and supporting them and validating the concerns, because that's really what it is. We're in a day and age that, hey, we need to believe her. What are they saying? What are they sharing? It's not all in the head. So I work heavily with that, and reproductive health for women and how it plays a role in psychiatry. And it's just really been rewarding. It's been really rewarding.
Yeah, I love your approach. The holistic approach I think is so helpful. I mean, I remember at some point I went to the doctor and I was having a lot of these symptoms and it was just not that primary care physicians are a just, but it was a primary care physician, not psychiatrist or a doctor endocrinologist or anything like that. And I was talking about how I was feeling, they did the screener for depression and anxiety, and I was definitely feeling depressed and anxious and a lot of other symptoms that are related to perimenopause. And immediately it was like, let's put you on some antidepressants. And I was like, well, can we check my hormones? Like, it's really discouraging when women are hit with that. And it does feel like you're being diagnosed with hysteria?
Yes, hysteria almost felt like you're being gaslight, gaslit
Yeah.
during it. So you bring these concerns up, and the first thing is, yeah, either birth control or, yeah, here's an SSRI. I'll see you in 6 months. Good luck. And it's like you're just kind of hanging out, like, hey, come on now. Is there more? Could it be more? And yeah, that's why I do that. Definitely will check the hormones. Now, yes, in the perimenopause, there is no definitive diagnostic testing. It's really, like I said, believing what is the patient saying. Some of the hallmarks that we know is the hot flashes, right? The night sweats, noticing changes in your hair. Some women are reporting that they're experiencing hair loss, the brain fog, the chronic, some people, fatigue, no energy, low libido. That is enough for me to determine that, hey, this isn't just a mental health. This could very well be hormonal changes, and you very well could be in perimenopause. And how do we support you? SSRIs, they do work. They can help with some of the fluctuation in the mood, but some people don't want SSRIs. Some people can't tolerate it. Some people want to look a little deeper and see what else can I do. So it's really looking at that individual and seeing what works best for them, not just the clinical studies and just the book, but what is working for you? How can I support you? How can we as, a medical society support? We've done a poor job, I would say, but now that there's more awareness, I think the resources are there.
Well, so I'm just going to d do some role playing with you. I'm just an
Okay.
idea. I'm going to be your patient, and I'm not going to make stuff up. I'm just going to tell you the things that I've been going through with perimenopause, and I'd love to see where you would start with me and what we would talk about.
Yeah.
Okay, so basically, and these are things I've gone through in the past, and maybe they're better now, but I'm just going to put them all out there because
Come on.
there's a lot of symptoms that we don't even realize are related to perimenopause. So I like to throw some of those out, and then after I say mine and we go through this, maybe you could tell me some of the other ones you've heard, so that
Yeah.
people listening can be like, oh, well, maybe that's perimenopause, maybe it's not something else. So, okay, well, so what I've been going through is definitely the mood fluctuations, uh, feeling really just irritable, just like without the patience I used to have, and do not feel warm and fuzzy towards my family members like I used to. Really just lower threshold all around. A lot of sensory issues. Noise is way too loud for me, and I've always been sensitive to noise, but it's a lot worse now. So a lot of the things that I was able to manage before, I can't manage now. So noise, touching, I'm trying to think of what else. Just sensory input, just like listening. I'm listened out for the day. I can't listen to anybody else. It's painful to hear people talk to me and have to process language. That's something that I've been going through. Lightheadedness, where I just feel like not vertigo dizzy, but just really lightheaded. And that definitely coincides with some brain fog. And the biggest thing is not being able to remember things in the moment, like words. Just can't remember a word, and can't remember a name of something I usually know. Things like that, where it's just like I usually know this, and it's at the tip of my tongue, and it's just very frustrating. Definitely problems with sleep. Not really hot flashes per se, but I will have like I'll wake up kind of hot sometimes, but not it's not like a hot flash or a night sweat, but just kind of a little warm, like my temperature modulation is off. Definitely, yeah. I've already said the grumpiness. Definitely the grumpiness is there. The low libido is definitely there. I'm trying to, my shoulder. It's not frozen shoulder exactly, but my shoulder, like my one shoulder, it's just like I used to be able to write all the time and be fine, but now I have pain from writing.
Yeah.
Joint pain. It's another one. Just not feeling like myself. Like a kind of an existential crisis of like, who am I? This doesn't feel like me. So those are the things that I've been dealing with. Where do you think we should start?
Yeah, I mean, that is right along the lines of what I tend to hear. It's a very common thing that I hear in practice. So um, I'll ask a little bit more. So you mentioned low libido, sexual health. Have you found a dysfunction in your sexual drive? So the libido you mentioned. What about, are you noticing painful intercourse, painful urination? Those are some other things that are very common for those in that perimenopause or full on menopause. Um, weight gain. Sometimes that weight, you're like, I'm working out, I'm mindful of what I'm eating,
Mm,
I'm cutting down the calories, the weight's not budging. That's another thing that is very common when you're in that menopause, perimenopause, menopause stage. So, really, what it is just the decrease in the estrogen and progesterone. That is what we're finding. Estrogen is very neuroprotective. It's great for bone health, cardiovascular health. It just serves our body so well. So when you have the fluctuations or the decrease, you will feel it. That's where the brain fog is coming in. That's where you're noticing the irritability. You're not steady. You're just kind of go, go, go. I mean, I look at it almost like a gas meter. You're one moment you could be a quarter tank, maybe half a tank. You're going down fast. It's almost like you're speed, brake, gas, brake, back. Like, no one's going to feel good like that.
Yeah.
So it's really listening. So based on all the symptoms you shared, right? Listening to you and then asking, what do you want? What's the priority for you? Do you want to feel more like yourself? Do you want to feel more like the 20-year-old version or just who you were 5 years ago? Do you want to have, your sex drive back? And I know it's almost like cliche, you're like, well, duh, but do you? Because what are you willing to do for it? So some people, they're like, oh, I'll just live with it. I'll manage it. I spoke to my, my OB. I spoke to my PC. They said it's just normal. It's part of life. It is what it is. Or we could be active and proactive and do something about that. So it's really asking, I really like to collaborate with the client and really ask them, what is the most pertinent thing for you? Is it feeling more like yourself? What are actionable steps that we can do to get there? In the meantime, for some people, it could be, an SSRI to kind of help stabilize things. For other people, it may be bioidentical hormone replacement therapy, replenishing the estrogen and progesterone. For those with the low libido, it might be testosterone. It might just, be introducing these things as a fuel to where you're being depleted. And also looking at diet, of course, what are some things that will support my hormones, support my mood? Sleep hygiene comes into place. Exercise, are we lifting weights? Are we bearing weight? Because as again, as the estrogens decline, it's very protective in preventing osteoporosis. So you need it to support your bone health. So we have to consider weightlifting. What does that look like for you? So it's really partnering and laying out plan and actionable steps that are practical that you can achieve so you feel better.
Okay. That sounds awesome. I mean, you're definitely looking at all of the areas, and I really love the question that you're asking, which is what do I want?
Mm-hmm.
Because like you said, maybe the low libido is not a problem for me. Maybe it's not a problem in my relationship or whatever. So it's like, okay, well, let's just put that one on the back burner and let's look at what's really important. And let's say what's most important to me is my career right now. And so I need to address the brain fog and I need to address the dizziness and lightheadedness because it's impeding on my workflow and things like that. So I will tell you that what really helped me with those things was I'd already been on progesterone, but it's funny after an interview I did with a functional medicine doctor, she was talking about estrogen, which my hormone doctor that I've been seeing was like, your estrogen's fine. And it was at 78 was my estrogen level. And I've heard from a few different functional medicine doctors that really they want you around like 150 for
Mm-hmm.
estrogen. And so that to me, I was like, because I had been thinking like, I don't need estrogen yet. But then I got on the patch, which I will say was a rough ride to get on the patch for me because I'm really
Mm-hmm.
sensitive to everything. But it has so been worth it. So now I'm doing the progesterone 100 milligrams and 0.025 milligrams patch, and I feel a lot better, a lot more like myself. I haven't addressed the testosterone yet, so libido is still out there, but I wanted to do one thing at a time because I have a sensitive system, which sounds like what you would probably recommend as well. So that's my next step is to address that. But yeah, I mean that has made such a difference for me with all of the symptoms that I was just saying, except for the low libido symptom. But actually, because I feel more emotionally stable now, I do feel my libido is higher even without the dealing with the testosterone yet, because there was the emotional component of it too. So being able to address all those areas. But I had no motivation to do the things that I needed to do for myself, like you said, like lifting weights. I was
Yeah,
like, just no
absolutely.
motivation to do that.
Yeah, it's like and it's almost like you're going against the wall because within you, deep within you, it's like, I know I want to do it. Like, I know I need to show up for my, my friend's graduation. I want to be a part of family gatherings. I want to take on more roles at work, but you just physically don't have it in you. It's like you're just going against yourself. And then sometimes you're being told, oh, you're just being lazy, or you don't want it bad enough. The thing is, you just don't have it in you. Literally, you're being depleted. You're
Yes.
being
Yes.
depleted. And yes, you will go to a lot of, like I say, conventional doctors, providers, and you share these, concerns, and they're like, oh well, you're fine, you're normal, there's no concern. Or they'll be like, this is the part of, the reproductive, this is part of aging. And it's like, okay, I understand it's the part of aging, but I want to age well. I want to have an optimal health. I don't want to just do the status quo, because it's impacting my quality of life. And that's what should be the parameter. How is my quality of life? How am I showing up for my family? How am I showing up for, those around me? How am I showing up in society? Is this the best version of myself? What's getting in the way of that? And when you're able to address it, like I said, what do you want to do about it?
Yeah. And how am I showing up for me too?
Yeah.
Because as women, we feel very much pushed into the corner and be like, well, it's okay if you suffer. I mean, I
Yes.
think that women have really felt that in the medical community. It's like, well, let's just make you more palatable for everybody else. But if you feel internally terrible, that's just part of being a woman. So, just
Yeah.
deal with it,
Yeah.
And so then we start to believe that, okay, well, I guess I just have to suffer through it and I just need to be quiet about it and not bother anybody and, be a good this and that and not and show up for everybody else, but maybe I don't even have the bandwidth to show up for me anymore.
Exactly. And
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 that's
how can you
okay.
pour in? Yeah. How are you going to pour into others and you are depleted? Yeah.
Yeah. Or you're trying to, but you're just depleting yourself more and more and more until you hit
Hmm.
that wall and then can't function. So
Yeah.
that's why for me that and I see that you're doing this too, the mission of getting this information out to people so that you don't have to, I want all of you to know that you don't have to hit a wall to finally do something for yourself. Like you said, you can optimize your well-being and you're worthy of optimizing your well-being. You don't have to just stick yourself on some medication so you're not a problem for anybody else.
I love that. Heavy on that you're not a problem for anybody else, but is it a problem for you? Because
Right.
like you said, you're palpable for everybody else because you're not going up and down, going off the hinge, so to speak. But internally, I mean, the med is not addressing that root issue. It's just kind of keeping things, it might be band-aiding it, but it's not addressing it. It's not addressing that, hey, I am depleted of the vital things that have kept me going all throughout my adolescence, throughout my early adulthood, and now I'm at a standstill. What can I do about it? And I just feel like the medical world, they're not, I mean, we're getting as more information is coming out, but they're not okay with not giving you another solution. It's just, here's the antidepressant, that should be enough. You're asking for too much. I'm barely asking for anything at this point.
Yes. I'm just asking to feel good inside
Yeah.
my body and to not have an existential crisis every day that I wake up.
Yes.
I mean,
Yeah. How would you say you've noted, and some people want to know, how soon did you notice the improvement in your symptoms, and how did you see, you're saying you're feeling better, but how do you see that it's showing up, in your workspace, your family life, so that people can even get an idea of what to expect?
that's a great question. Yeah. Well, for me with onboarding the estrogen, I guess my estrogen had been pretty low for a while and I just didn't realize it. And so now a lot of women do not report this, so I don't want to scare anybody, but it was a pretty rough road. It was a good 6 to 8 weeks before I felt really good physically because I got the nausea. And I mean, I just basically felt like I was pregnant. And, like it was just like, oh, wow, this is a hormone my body hasn't had much of for a while. And so I had all the side effects. But even during that, I was feeling more like myself. Like I noticed I liked people more. Now, I have a huge amount of empathy and I love people in general. That's why I'm a therapist. But I just felt more like, wow, I just feel good about you a little bit more than I had felt before and that I think that impacted everything in a positive way, made me feel better. Everyone around me, I'm sure, felt better as well. And of course, I mean, a lot of times this mainly impacts people who are really close to you. So my husband and daughter have been appreciative of the change. Um, And my mom too. I think she probably noticed. But um but so that was the first thing I noticed, and also just feeling like I had my sense of humor back. I
Mhm.
just for a while did not think anything was funny. I mean, things I was just feeling, like mild depression, like I would say anhedonia, kind of like Eeyore like, it's just like
Yeah.
wah wah, you know, hard to be excited even about good news and things like that. So that started to return where I could feel some of that joie de vivre, like the love of life coming back, and like just enjoying things I used to enjoy before, like reading and yoga and walking. And I was doing all those things, but I wasn't really enjoying them. I just felt like I was kind of floating through life, which feels a lot like depression, but I don't have a history of depression. So I knew it wasn't really that for me.
Mm-hmm.
And so that's why I didn't want the SSRIs for myself. And when people don't have a history, I don't want to look at that as frontline, which is what I hear you saying as well. But yeah, I mean, basically that's what I started feeling at first, and now that I'm on it, I'm 2 months in now, so it's still pretty new, but I am just getting to where yes, I feel like myself. I still have the hormonal changes because it doesn't like change all of that. You still have those, but it's just not quite so low. Like when after ovulation, when estrogen will dip for like 2 to 5 days, I used to think that I had a stomach virus every time because my estrogen would drop so low that I would get the lightheadedness, the like really dizzy, and nauseous because my
Mm.
estrogen was low. So it's like the nausea doesn't just come from onboarding the estrogen. It's when it's too low too. And so
Yeah.
I didn't even realize that like nausea could be from estrogen being too low. But so that's improved. I went through that period of a month, and I did was things like I didn't have the dizziness and the busy time. So I'm seeing some of those things improve as well. So it's really helping me, like feel more like myself. Um, and so, but for me, it was a longer road. Some women have reported feeling good pretty quickly and not having the side effects. So, I mean, it's definitely different for everybody.
Yeah.
But I definitely felt like my body was like, oh, I needed that. Like, yeah, there's estrogen receptors in all of your organ systems. So
Mm-hmm.
our bodies need it.
It does. It needs it desperately.
Yeah.
Desperately. And I'm just happy that there is more awareness, and people don't have to. It was just a weird thing. There was this common thing where people were just suffering, and it was just you're just being told like, yeah, it's that's just part of what it is. And you just kind of think back. I think back to even some family members, some of my aunts, and I'm just like, man, you could tell when I look back. I'm like, oh wow, they probably were going through that because they were more irritable, more snappy, more withdrawn, you know and they used to be the life of the party. And it's like, wow, if the information we know today was just presented back then, what would have been their life now? It's almost
Yes.
like you were robbed of that.
Yes. And really I went through a time where I just felt like a shell of myself, like I was just watching my life.
Mm-hmm.
And it was hard to participate in it because I felt so bad. So I've yeah, and this was and I'm 46, so I was thinking I think that I don't think I'm old enough yet to have like to need to add the estrogen. And I was getting that feedback too from professionals that I was seeing that were specific for hormone replacement therapy. So I and it, so it was until I was able to talk to the functional medicine doctor that really alerted me. So I think that's important to know too, is that you don't have to. A lot of times people think, well, we need to start adding estrogen in when there's like no estrogen. When like you've
No.
gone through menopause and you start with a lot of estrogen, but starting with even just a little bit, just to bring you up just a little bit, is life changing. And that's
Yeah.
been my experience.
Yeah, it has. I mean, you don't need for some people, you don't need a lot. I mean, like you said, you're on the low dose, so it's not a whole lot to begin with. And there has been enough studies that saying that, hey, perimenopause can start as early as 10 years before you're in full-blown menopause. So there are 30-something-year-olds who are already experiencing menopausal symptoms. I
Yep.
see them, and it's the same hallmark symptoms that you would see in menopause. They're having brain fog, and it's like out of nowhere. So I'll ask, like, hey, any recent changes, any changes in your, they're like, everything in my life on paper is fine, but I don't feel fine. Like,
Yeah.
my relationship hasn't changed, my job is still here, everything's good, but just I don't feel right. So when I, ask a little further, and then they'll tell me, yeah, it's this, I can't function. I just don't feel like myself. I'm more irritable. Am I, some of them like, am I bipolar? I'm just going up and down, up and down. And these are people who are in their early 30s. It could be
Yeah.
so many things could contribute to, already experiencing that. So some people, it could be through surgical, some people who've had hysterectomies start to experience those symptoms. So they'll put you maybe in early menopause or premenopause symptoms, certain medications. If you had a history of being on chemotherapy, sometimes it can do that.
Mm.
There's other things that can contribute to those symptoms and the fluctuation, but everyone could benefit from progesterone. I mean, you could
Mm-hmm.
be in your 20s and still benefit from progesterone.
Oh yeah.
It's
Yeah.
so good for your mood. It's great for your sleep. It's a feel good. It's the feel good hormone. So yeah.
Yeah. Yeah, I can't say enough about progesterone. I started that actually when I was like 36 and my daughter had weaned and I had this like huge crash and I just felt terrible. And I don't deal with depression, but I've had anxiety my whole life and progesterone helps so much with that because it just interacts with the GABA pathways. It helps soothe everything. I mean, yeah, it was life changing for me. So I've been doing that for over 10 years now. So
Yeah.
yeah, you can take, like you said, you're never too young for progesterone. Well, I guess you can be too young, but yeah, I had a client in their 20s. I referred them to get tested for that and they really benefited from starting progesterone that young. And I think that's an important thing to note is
Yeah.
that you don't have to be going through perimenopause to look at progesterone because some people just have low progesterone.
They do. They certainly do. And I mean, and why I kind of make this you're never too young is, I mean, if you think about it, um, teenagers on birth control, adolescents on birth control, what's the difference of them just not doing micronized bioidentical, progesterone? Because they're taking it already.
Yeah.
I mean, they're already taking it. Um, it just may help them a little bit more. But obviously, that's between, we have to be mindful of progesterone because it is still the pregnancy hormone. So you can ovulate and you want to take measures if you're not ready to start having
Yes.
children. So that's something to keep that in mind. But yes, people would benefit from it. It just would help. It's all about just quality of life. You don't have to just muddle through the day and just show up. Like, are you showing up at the best version of yourself? Are you happy with what you're presenting? And like you said, for me, am I happy with me? Everyone else can validate me to left and right, but can I validate myself? Can I be comfortable in the skin I'm in? And that's really what it's about.
Yeah. Yeah, and really feeling that because I think as women especially, we really know how to mask.
Mm,
And so everybody can think that we're fine and internally we know that we're not. And we're worthy of taking that, making that effort, the effort you would make if you're a mom for your child who wasn't feeling quite right, like worthy of going to the doctor, worthy of advocating for yourself because you might not get the first person you see might not get it and you might have to advocate to get hormones tested and to get that kind of intervention.
yeah. Yeah, I love that you said advocating because, some people, they may ask, okay, well, Tara worked for you. You went to somewhere and they listened to you. What about me? How do I navigate? What do I look for? Um, well, it's a little bit harder through the conventional medicine because, first and foremost, if you're going to your PCP or OB, they only give you like 10-15 minutes. So, they do their assessment, ask you questions, and it's usually at the end. That's when you're like, oh, by the way, I've been noticing these changes. And they're like, okay, here's your oral contraceptive, or here's Zoloft. I'll see you later. They don't have the time. So I really encourage people such as yours, like you did, you may have to go and look at more of that alternative, like integrative clinicians, look at a functional medicine specialist. Because even those who do hormone, you know, even some hormone specialists, sometimes like they told you, they'll, may say, oh, you're not at that age, you're not qualified, or it's not necessary. Where usually from functional medicine or integratives, like we're looking at the whole picture and we want to know, what is the harm risk to this? What is the harm risk of you not doing it? And what is the harm benefit risk pros of you doing it? And really weighing that out and presenting it to you. So it should really be a collaborative approach of what's going to serve you in the season that you are currently in, with all that you have on your plate. What's the best thing? So you really want to look for people who are looking at the whole picture, who want to do the deep root work, who really want to sit with you and explain things and give you the time, and it's not rushed, because 10 to 15 minutes is not enough time to really thoroughly hear the concerns of your patient. And that's not enough time to really, get the treatment you need.
So if I were to come see you, or one of our listeners were to come see you for integrative care, what does that look like with you? Do you, is it, yeah, how do people schedule with you? What do the appointments look like? Just give me a picture.
Yeah. So yeah, they can always, check out my website and be able to get a feel for what I'm offering. So I'm really want people to I'm all about having people having options, right? So go on there, look through what I'm offering, what my mission statement, what I'm about, and see if that aligns with you. And then if it does, they can always reach out. They can call the clinic, but they can fill out the intake form. It's just a quick, just name, number. And then I do call and I just want to hear a bit about, what are you seeking? Does this, what I'm doing, align? I am someone, when I say holistic, it really is looking thoroughly, your lifestyle, your relationships, your social media use, your sleep, your value systems, your support. What are you consuming? What fares well with you? How are you showing up for yourself? So it's really deeper work, a full picture, rather than you just tell me, oh, I've been depressed and anxious. What are some things that are triggering you? Then yes, I'd like to do a full panel, blood work, and really see, are these numbers optimal, not normal. We've all been told, oh, it's normal or it's fine.
Hmm.
Well, who is it fine for? Was it normal for? Was it a 36-year-old white male? Who were you basing the parameters?
Yeah.
Because I tell people, let's say the range for one of the markers is like for 5 to 10, right? And you're at 6. Technically, you're normal because you're in range, but you're on the low end and you're still having these, symptoms. So that lets me know it's not optimal. So we're going to work on making sure that those numbers are best for you. That could be through dietary changes, supplementation, lifestyle modification. And then if we do need to add medications to support you and keep you stabilized, most certainly we'll do so. We'll do that. Medications certainly have their place. They do work. But again, not everyone can tolerate them. And some people may not even need it. Like, go figure. Some people may not need the medication at all. So that's why you do yourself a disservice going to, I'm not saying all, but some, in the case of psychiatry, going to a psychiatrist, a psychiatric nurse practitioner, having a 15-minute med check, and then being placed on a medication, given a diagnosis, and then, momentarily you may feel better, but you still report the same symptoms. That lets me know we're not addressing the root issue. Could there be something else at play?
So that sounds like a longer than 15-minute
Yes. So
appointment.
those
Like that.
appointments, yeah. So my appointments are 90 minutes. The initial
90
intake is
minutes.
90
That's
minutes.
great.
90 minutes. And some people are like, 90 minutes? What can I say? Believe me, we go over sometimes quite a bit. even with the 90 minutes, because I'm extracting information and I'm making you think. I'm making you align with what do you want. Is it just suppressing these symptoms, or is it really getting to the deep root of what is causing you to anguish? Because you're saying something, but your blood is saying something else. So we want to see how they align. You're saying brain fog, but your blood is saying low ferritin. How does this align? So you're saying the symptoms of what you think, but the blood is saying until you address this, you are not going to find peace within. So that's what my whole purpose is to making sure we have these things aligned, educating you on where these numbers need to be, educating you on how, we want to optimize these values, these numbers, and then eventually you would get it through the food source. You would get it through the lifestyle changes and modifications, and really supporting you on that journey. So what you feel most comfortable with. If you're not comfortable with starting a medication, if you're not comfortable with this treatment, is us finding, a middle ground.
So we'll go back to the example of me being the patient, and all the things that I said, and maybe you could even add in some other symptoms that people have told you. So if I come to you with all of these things, what kind of blood tests are you going to recommend for me? What do you think I should get tested?
So yeah, I would still do hormone panels. So we could still look at the sex hormones, estrogen, fractionated estrogen, testosterone. But I am really noticing a huge trend of individuals with low thyroid, um, low ferritin and iron, um, just really a lot of nutritional deficiencies. Even something as simple as sodium, low sodium can cause you issues, headaches, nausea, cramping, brain fog. You don't realize when your electrolytes are out of whack, you will feel those symptoms. So we have to replenish it. uh, Traditionally, whenever people check your iron, they just get the iron. They don't do the ferritin. Well, ferritin will let me see the iron storage. How much iron do you have in the bank? So I give this analogy to my patients a lot is, ferritin is your bank. Iron is what you have on cash, is
Hmm.
what you have in hand. So you may have a certain level in iron, but the ferritin lets me know how are we storing it. Then we want to look at the saturation, right? How much of the iron binding sites do you have? Because iron is very vital to hormone health, circulation. When people are reporting chronic fatigue, brain fog, those could be very, those can align with low ferritin and low iron. So I really, really do love to, do an extensive panel. I do check B12, folate. We also know that, yeah, low folate, there has been a lot of studies that, hey, those who are not able to properly convert folic acid to methylfolate, they may have to take, B12 complex or folate supplementation. There's links when you're depleted in that, you could be experiencing depressive symptoms. So we want to address that, um, rather than just you taking a medication and never addressing if there's anything else. And some people, there might not be anything else, but to this day, I have yet to find that. I have yet to
Mm.
find one client that didn't have anything else going on under the hood.
Yeah, yeah. That makes sense because even as healthy as we try to eat, the soil is depleted, so we're just not getting our nutrients.
And that's it. It's the nutrients. And then obviously, as we're learning more, the gut brain axis, how it's connected, what is your gut optimized? Do you have yeast overgrowth?
Mm.
Are you absorbing the nutrients? Because you could be thinking, hey, I'm eating all these healthy things. I'm taking my supplements, but nothing's changing. So maybe there's an absorption issue. Maybe we have to look at that. Is there anything going on deeper? So that could be it. There's some people who are like, I've done everything in the book, but nothing's changing. So that's why you have to do the due diligence and just look a little deeper.
That sounds great. It
Yeah.
sounds like you're really looking holistically, like we were saying. Well, so I want to put out for anyone listening, just any other symptoms that you see people bring in that I haven't mentioned that we might just be able to kind of throw out there, are things that might be related to perimenopause or nutritional deficiency or a combination of both.
I would say, I think we hit, it's really the same. It's the main hallmark, what would align with perimenopause is, yeah, it's going to be typically the vasomotor symptoms, the changes in their sex drive, the cognition, the joint pain, irritability, the mood changes. So I feel like we've really addressed and hit it all, and that's what I have been seeing. I've heard the same thing.
Okay. It's pretty
Um,
common.
yeah, it's very common. And the thing is, these same symptoms align with, what you would find in someone with depression, someone with anxiety.
Hmm.
So that's why their PCP or OB will send them like, oh, I think you need to go see psychiatry. I think this might be, a mental health. But then when you really take the time and listen, like, yeah, it's impacting your mental health. But really what this is the changes in your, estrogen, progesterone, and hormones.
Well, I'm sure as people are listening and they're thinking, okay, well, I really do need to do something for myself because I am worthy of this care and not having an existential crisis every time I wake up. And I do want to feel like myself. And I do want to have more of a sex drive, or I do want to feel more warm and fuzzy towards my family, or et cetera, et cetera. So in that case, where could they find you? You said you have a website. Yeah, where can people find you? How would they onboard with you?
Yeah, so you can find me on, so it's www.nuvointegrativepsychiatry.com. You can Google me, so you'll be able to find me on Google. I am also on Instagram and TikTok, which would be and Nuvo IP. So yeah, at Nuvo IP. So I, provide a little information there. But yeah, they can just reach out and I'd be happy to assist them and come along to ride.
Okay, and I'm going to say your name again because I only said it once at the beginning. So people are like, I don't remember her name, right? Brain fog. Jennifer Adesina.
Yes, Jennifer
So
Adesina. Absolutely.
thank you so much for your time today. This has been so helpful, and I hope that our listeners also have found it as helpful as I have. So thanks for letting me be your patient too.
Well, absolutely. And thank you for having me. It's a pleasure.
Oh, whoops, hold on. Sorry. Okay, stop recording. Okay.